Hi everyone, I'm Ian. No. Hi everyone, I'm Ian Harvey, massage therapist. This is my friend Ashley.
Hi.
Today we're going to be talking about the rotator cuff. This is my friend Heather. Today we're going to be talking about the rotator cuff. We're going to be working with the four muscles of the rotator cuff, including subscapularis in a way that you may have never seen before. We're going to be working solely in the prone position, so if you've only seen some of these worked in a supine position, some of this might be new for you. So let's get started. Okay, so what we're talking about here is muscles that attach to the scapula. This rotator cuff, when all four of them are acting in concert, indeed acts like a cuff. They pull the head of this humerus into the glenoid fossa. If they're all pulling too hard, that can create problems here. It can even refer pain forward to the anterior shoulder. When I hear about front of the shoulder pain, I think rotator cuff, specifically infrapinatus and subscapularis, which I didn't really touch it there. We'll get into that in a second. It's a very armpit-heavy move. All right. So first of all, infrapinatus lies inferior to this spine of the scapula here. Anything on the blade of the scapula itself is going to be infrapinatus. Teres minor, infrapinatus and teres minor are both external rotators. They bring your arm out like this. You've got your teres minor over here. You'll contact this by pressing against the lateral border of the scapula. Supraspinatus lies in this supraspinous fossa. It's above the spine of the scapula. If you're pressing down and you can feel the spine of the scapula just south of your finger, you're in that supraspinous fossa. If you go up too far, you'll kind of be in the divot between the scapula and the clavicle, and you'll be able to contact first rib. But if you stay close to this spine of the scapula, you'll be on supraspinatus until you reach this V formed by the spine and the clavicle, and then you won't be able to work on it anymore because it dips under that acromion process. And finally, we've got subscapularis. I'm going to show you where it is kind of a little bit more later. It lies deep to the scapula. It's sandwiched between the scapula and the ribs, so it's very difficult to contact. If you try to contact it coming from this direction, you'll be hitting some of the tendinous attachment on its most medial portion. You're not going to be hitting any of the belly of the muscle itself. So we'll talk about how to access that. First of all, if you're going to be working with these specific muscles, especially if you're going to be working with trigger points, warm the area up. And I'm going to think broadly. I'm going to move these sheets of fascia, and that's going to affect all four rotator cuff muscles, along with everything that's connected here. Trapezius, latissimus dorsi, serratus anterior here, levator scapula up here, and of course all of these paraspinal muscles. They'll all get affected in one way or another if you're steamrolling this entire area. So I'm not pressing directly down, I'm pressing out. That's what I consider the myofascial angle. You're pulling those sheets, you're giving some traction to that tissue. And I like to do some nice two-fisted steamrolling, starting from those spinous processes and moving laterally toward the axilla. And you can go even further than that and get out onto the humerus and work with deltoid a bit. This drag is going to have effects all the way medially. Another nice warm-up that's going to affect mostly these three rotator cuff muscles, infrapinatus, teres minor, and subscap, is going to be starting from the lower ribs, I've got my elbow tucked into my side, and I'm redirecting my pressure this way, toward her spine and northward. And what I'm going to be doing, one, is getting some nice traction to this lateral thoracic fascia, but also I'm going to be applying some compression and some fascial traction up into the axilla, and that's going to affect everything that manipulates this entire shoulder girdle. I'm applying a pretty decent amount of pressure using the palmar surface of my hand, pressing down toward the table as well as up at this point. And if I hang out here, I could feel some softening of these tissues. And this other hand is here just as comfort and also to take some of my weight so I can be lazy. Easy peasy. And this is a good first chance to do some mobilization, do some petrissage up here into the shoulder, use this hand to grab the arm and drag it back down a bit so that they're back in a more neutral position. And now that I've done this, and I've already done a bit of petrissage up here, I've already done some general back warming, this is a warm shoulder girdle. This is ready to receive some more specific work. So let's talk about how we can work with each of these rotator cuff muscles specifically. First of all, if I want to work with infraspinatus, anything that I do on this blade of the scapula, on this flat portion, is going to do the trick. So a nice open fist going up toward the spine of the scapula, kind of again steamrolling my way up, and then coming out laterally. This is following the muscle. And I can layer that and repeat it using the other fist. Sorry if my arm was blocking some of that. I'll fix it in post. Can you do that? Probably not. Okay, and if I wanted to get more specific, I'm going to use fingertips or thumbs. And once you get into fingertips and thumbs, you can feel this interesting texture of infraspinatus, how it's very lumpy and bumpy. If you look at a muscle diagram, you'll see that infraspinatus is not a smooth, consistent looking muscle. It's a lumpy, bumpy muscle. So if you're going through here and you feel lumps and bumps, those are not knots, my friend. Those are just infraspinatus. But on those lumps, you'll probably find some good trigger points. And they may even refer forward into the anterior shoulder. And that's a perfectly fine thing to work with. Just don't feel like you need to break up those knots. Okay, so that's infraspinatus. Remember, we're working all the way to this medial border of the scapula and going all the way up to the spine of the scapula. If you fail to outline the spine of the scapula, if you fail to make contact medially enough on this blade of the scapula, you're not hitting the entire muscle. And coming out laterally like this, you're following it as it becomes more tendinous. We've also got supraspinatus, which is up in this supraspinous fossa. When you're working with supraspinatus, I want you to feel for that spine once again. If you're way up here, you might be off the scapula completely. Versus if you're sticking right next to that spine of the scapula like glue, you're going to be on that supraspinatus the entire time. Supraspinatus is an abductor. And I feel like sometimes it's given too much importance when it comes to frozen shoulder. I feel like there's usually a lot of dysfunction down here that needs to be worked with, but I'm willing to be wrong about that. When you're working with supraspinatus, just realize that your tools are going to need to be relatively small. I tend to use fingertips for this one. You can find trigger points all along its length, but a very common place for trigger points is right where it meets with the clavicle. So you're following the spine of the scapula just superior to it, and you're going to hit this V of bone formed by the clavicle and the spine of the scapula, and there will usually be a trigger point right there. Next up, we've got the teres muscles. So teres minor is the only one that's considered a rotator cuff muscle, but when you're working on one, you'll likely be working on the other. So teres minor is an external rotator. And you're going to find it anytime you're pressing medially on this lateral angle of the scapula. So if you can feel this lateral bony portion of the scapula, you're on the teres muscles. And you'll find trigger points all along its length. Finally, subscapularis. Okay, to hit subscap, some of you may have learned in school that you can come at this from the medial portion of the scapula. Like if you were to get under this scapula, that you could work on subscap. And while it's true that you're working on a portion of subscapularis anytime you're under the scapula, just realize that this medially, we're primarily working on the tendinous attachments of subscap. Not only that, but we're also working through these sheet-like muscles that form this upper back. So it's rarely the best way of making contact with subscapularis unless the person has an extra mobile scapula. I find a much easier way and a much more effective way is to come in laterally. Now some of you may do this while the person is supine. I find that this is much less invasive feeling when you do this while the client is prone. So you'll notice how easy that was. All I did was kneaded my way under that scapula. My thumbs are currently pointed up. They're currently anchored in to that subscap. If you can feel the anterior surface of the scapula, you're on subscapularis. And this is not a muscle that is ever touched, so be nice while you're here. Go slowly, and realize that any movement you make here is going to take you to a different portion. So if I angle my hands more superiorly, now I'm working more toward that attachment site, that insertion site of subscap, and I'm getting more onto the belly itself. I wouldn't work with trigger points the first time I was working with subscap. I would leave that for a future session because right now you're just familiarizing the muscle with contact. But something neat that you can do from this position is once your thumbs are contacting the muscle, you can press down with a duck grip, and suddenly you've got the fascia for nearly the entire rotator cuff in your hands. And so if I'm pressing my thumbs toward my fingers, I've got my hands around the entire rotator cuff fascia minus supraspinatus. And if you just hang out here for a while and allow yourself to slowly come out of it, so slowly coming laterally, this can create a world of difference in how the shoulder feels. As I come out even more and go more and more laterally, here I'm on teres. I've got teres pinched between thumb and fingers. I could just stick around here for a while and wait for this to soften. It's a different way of working with those teres muscles. To finish up, let's do a little mobilization of the scapula. Now the easy way to do this is to put the hand in the low back, but I think that's cheating. Not really, that's a perfectly good way of doing this. But I like to just scoop this glenohumeral joint, come up with my other hand and slide my way under the scapula. From here, I can use my thumb and grip underneath the scapula, and just by rocking my body, I can mobilize this entire scapula and everything that it attaches to. This can be a great way of finishing off rotator cuff work. You can also lift up toward the ceiling. This is a stretch that people cannot do themselves. And I can pull out laterally, push up medially, and finally depressing the shoulder. Okay, leave me some comments. Let me know how this works for you. Consider subscribing, and I'll see you next time.